Good morning. My name is Tiffany Frederick, and I will be presenting on multiple sclerosis in my adapted physical education and sports class, Dr. Kaiser. Multiple sclerosis is an unpredictable disease that is in the central nervous system that disrupts the flow of information within the brain and between the brain and body. It destroys the myelin sheath, which is the white matter in the brain, which sends the information to the gray matter in order for the brain to process information or movement. So once the white blood cells or the white matter is infected, that's where MS begins. I have presented a small video that describes and discusses a little bit about the gray and white area of the brain. How common is MS? 1 out of 750 adults are diagnosed in the United States. 1 out of 40 adults are diagnosed each year. Diagnosing MS has become more clear by symptoms related to vision, such as eye pain and blurred vision. 80% of early diagnosis is associated with fatigue, symptoms, and eye pain. New studies have been found that the gray matter, the white matter, once that white matter is affected, it causes blurred vision and pain in the eye, and severe fatigue are symptoms that they're finding to be more common in early detections. Common physical symptoms of MS: fatigue, tingling and numbness in the hands, feet, and legs, blurred visions, temporary blindness. Less common symptoms that are most dangerous are seizures, difficulty swallowing, and breathing problems. Fatigue is the most common. And when we think about fatigue, now we're tapping into that psychological effect, which also causes depression amongst MS patients. So that's why exercise is really, really important, so that MS patients can live a more healthy and happy life. Common cognitive symptoms of MS: trouble thinking, difficulty concentrating, memory loss, which affects the ability to learn and remember information. There are several different treatments in dealing with MS. You have oral medication, which is given daily and less expensive. Injections are given in the early and active ongoing stages of MS. Infusions are given during the relapse stage to help the body through remission. Physical therapy is given to strengthen the muscles and help decrease inflammation from the brain. Physical therapy is very, very important. Again, I can't stress how important it is psychologically and physiologically. The more active you are, the more you can keep those muscles strengthened, flexible. Is all about strengthening your muscles. Teaching a student with MS, you want to keep exercises moderate, but daily. Short, 30 minutes will pretty much do the trick, but it needs to be very, you need to hit every skill, such as stretching, which increases the flexibility, balance exercises. You need to kind of throw all of that in there so that the body is balanced. Pool exercises are highly recommended to help increase balance. I know in schools, most schools don't have a pool, but if you can get with the parent and kind of set up some things and give them a workout plan, so on the weekends they can really get in that pool and it's less stressful on the muscles, and it helps increase balance. Because MS patients are intolerant of heat, you want to make sure that that pool is at 80 degrees or below. Positive attitudes affect students' outcomes, so it is very important that the teacher has a positive attitude when it comes to teaching MS patients. Exercising and helping students with MS. Again, strength training is important to help those muscles stay strong. Balance, which we talked about earlier in the pool. Stretching is really, really important so that there's no staticity that's created in the muscles. Activities that MS patients can do. Yoga is great. Again, flexibility. We want to keep our range of motion. Chair exercises where we're not just standing all the time and where we can still get the mobility and flexibility. Arm lifts with very light weights. Arm lifts to keep those muscles in the arms active. Bowling, table tennis, non-contact sports where our muscles, where we don't have to get that increased physical contact, such as football, baseball, basketball, where we're touching a lot. And this concludes my presentation. These are the references that I use. Thank you so much and hope you enjoyed. Have a great day.